What's your name?
I'm Alex Rutowska.
And where are you from?
I'm from Bedford, Maine.
Bedford, Maine. Is that a little town or a big city or suburb?
It's pretty small. I would say it's more suburban.
Oh, so do you have any healthcare experience there?
No, not really there. I did in my hometown, but I was in Texas.
Is that also rural experience, or?
Where I was, it was about 5,000 people, so not too big.
Okay. But is that within range of a big city, or are you kind of on your own?
It's within range.
Okay. So, is that very different from being in Alaska, or is this kind of
Yes. No. It's way different than I thought it would be.
How so?
Well, the fact that you have to take an airplane to get to certain towns, that's definitely a huge difference.
Had you ever been to Alaska before?
No, I hadn't.
What were your expectations before you got here?
I didn't know what to expect. I expected it to be pretty, but no.
And was it pretty?
Yes, it was.
Really?
But, yeah, I didn't expect anything concrete, no.
So where did you go for your rural experience?
I went to Dillingham, Anchorage, Dillingham, Alaska.
Okay. And Dillingham is way out on the coastline of Bristol Bay. It's out in
Yes.
western Alaska. So, big fishing town.
Yes.
You're there right in the height of summer, which is
Yeah.
big fishing season. So, what kind of things did you get to do while you were there?
I got to go commercial salmon fishing, which was cool, but yeah, it's kind of interesting how they do fishing like almost every tide. So they sleep a few hours every day, you know, during the summer when fishing season is at its peak, and they'll just fish and fish and fish, and that's their money for the winter. So that's pretty crazy to me. But yeah, they bring their families, you know, that help them fish and everything, and it's just a culture shock.
It's the whole community involved in this one industry.
Yeah, yeah, and the like population fluctuates from like a few hundred to a few thousand because of the summer fishing.
Okay.
So it's crazy.
Were you doing some job shadowing in Kanakanak Hospital, is that right?
Yes, and I did go to the public health center in Dillingham, and basically I learned, you know, what the main problems were in Dillingham specifically, like certain STDs that were more prevalent in Dillingham, and, you know, the drug problems, and so.
And before we went out there, we had a few days here in Anchorage. We went out to the Alaska Native Heritage Center. We got to talk to some people at ANTHC about the practice of rural medicine. Was that a good preparation for you, or do you think that didn't help much?
I think it was and it wasn't, just because you're not going to really understand it until you see it, if that makes any sense.
No, it makes perfect sense.
Yeah.
But I think actually that's one of the things we were told by one of the speakers, is that you can't really grasp it until
Yeah,
you
no,
actually have
I
to
don't
do
think
it
you
for
do.
real. So, did you get the chance to embed yourself in the community at all out in Dillingham, or
A little
participate in
bit,
activities?
yeah. I participated in a color run that had to do with, you know, promotion of breastfeeding, was the pink color of the color run, and red was drug and alcohol prevention, and there was a tobacco prevention, and so it was pretty much put on by the Tobacco Cessation Clinic, and they made it so to promote a healthy lifestyle, pretty much.
Did you come in first?
Oh, I didn't run. I was throwing the red.
Oh,
I was
okay.
throwing the red powder. I did not run that.
And is this something you could see yourself doing long term, this kind of rural practice?
I don't think me specifically. Maybe less rural than this, but it was eye-opening to, I don't really feel I need or want to have to need to get a plane
You'd
to
like to work
fly,
someplace
yeah,
on the road
to fly somewhere, yeah,
Okay.
most definitely.
Well, that's a good thing to learn when you're
Yeah.
out there. It's part of the
Definitely.
value of the program, actually, is
Yeah.
learn what living there is actually like. Do you have any suggestions or recommendations for future students who might be in Dillingham?
Ask questions.
Ask questions?
Yeah, because that's, I felt bad for the doctor I was shadowing at the Kanakanak Hospital because I was just talking his ear off, asking so many questions during, while we were seeing patients or, looking at x-rays or whatever. But I think it just made the experience so much more fulfilling.
Okay, good. Thank you for talking to us.
Yeah, thank you.